Every 40 seconds, someone in the US has a stroke. For seniors, the risk is even higher. But what if we told you that the most powerful weapon against stroke isn't a fancy treatment? It's the simple things you do every single day. Most people think stroke prevention is complicated, but at Caring Senior Service, we know that small, consistent habits can make a life-saving difference. We have helped hundreds of seniors stay independent and healthy through personalized care that includes stroke prevention habits that truly work. In this video, we'll break down 5 easy, science-backed habits that reduce stroke risk. No medical jargon, no hard routines, just practical steps you can start today. Habit 1, eat smart, not perfect. First up, diet. Not the kind that makes you miserable. We're talking about eating smart, not eating perfect. Studies show that the DASH diet, which stands for Dietary Approaches to Stop Hypertension, lowers stroke risk dramatically. It's rich in fruits, vegetables, whole grains, and low-fat dairy. It limits salt, red meat, and sugar. Try swapping your morning toast for whole grain. Add a handful of spinach to your scrambled eggs. Or end dinner with berries instead of cake. One tiny change at a time. That's all it takes. Why does this matter? Because what you eat directly affects blood pressure, cholesterol, and blood sugar, all major stroke risk factors. That's the fuel part of your body. But what about movement? Let's talk about the second habit. Habit number 2, move more, sit less. You don't need a gym membership to protect your brain. Just keep moving. Movement helps keep your blood vessels flexible and clear. It reduces high blood pressure, a leading cause of strokes. The goal? About 150 minutes of moderate activity a week. That's 30 minutes a day, 5 days a week. But even 10-minute walks after meals count. Chair exercises, gardening, dancing to music, they all add up. The key is consistency. Think of it like brushing your teeth. It doesn't need to be intense, just regular. Your brain thrives on blood flow, and movement keeps that flow going strong. But even with good food and movement, there's one silent killer you can't feel: high blood pressure. And that brings us to habit number 3. Check blood pressure regularly. Here's a secret. Many strokes happen because someone didn't know their blood pressure was high. High blood pressure damages blood vessels in the brain over time, increasing the risk of both major and minor strokes, some of which you might not even notice until it's too late. Use a home blood pressure monitor 2 to 3 times a week. Morning is best. Keep a log or use a phone app to track your numbers. If it's consistently above 130/80, talk to your doctor. Early intervention can prevent a lifetime of complications. Think of it like checking your car's oil. Low maintenance now avoids a breakdown later. Of course, tracking it only works if you're also treating it. So let's talk about habit number 4. Habit number 4, take your medications. No exceptions. Medications can be life-saving, but only when taken consistently. Stroke prevention meds often include blood pressure pills, blood thinners, or cholesterol-lowering drugs. Missed doses mean missed protection. Set alarms. Use pill boxes. Sync meds with routines like brushing teeth or eating breakfast. Some seniors even use voice assistants to remind them. Ask your pharmacist for a 90-day supply or delivery service so you never run out. Think of medications like a seatbelt. You don't need it every second, but when you do, it can save your life. So now you're eating well, moving, monitoring your pressure, and taking your meds. But there's one final habit most people overlook. Habit number 5, prioritize quality sleep. Sleep isn't just rest, it's recovery. And for stroke prevention, it's essential. Poor sleep raises your risk of high blood pressure, diabetes, and atrial fibrillation, all major stroke contributors. Seniors especially are vulnerable to sleep disruptions. Aim for 7 to 9 hours of sleep per night. Stick to a regular bedtime. Avoid screens an hour before bed. Use blackout curtains or a white noise machine if needed. And if you snore loudly or feel drowsy during the day, get screened for sleep apnea, a hidden risk factor for stroke. Think of sleep as a nightly tune-up for your brain and blood vessels. You can't skip it and expect peak performance. Stroke prevention doesn't require radical change. It requires consistent care. These 5 habits, simple, doable, and powerful, create a safety net for your brain. Eat smart, move more, monitor blood pressure, take your meds, sleep well. Remember, every small habit is like a vote for your future health. One habit won't do it, but together, they're stronger than any stroke risk. Stroke prevention is possible, and it starts with a few small changes today. And if you ever need help along the way, Caring Senior Service is here to serve you. Thanks for watching.